We are here to present a training through the MTAC Center on transportation strategies. If you have a moment, please just take a second to put your name, your agency, and the role within your agency in the chat. Just want to make sure we get a opportunity to welcome you all. And I think we pretty much have everyone in from the waiting room at this moment, so we will get started. Just a quick little disclaimer. This presentation was prepared for the Medi-Cal Mobile Crisis Training and Technical Assistance Center, also known as the MTAC project, which is funded by the California Department of Healthcare Services and administered by the Center for Applied Research Solutions. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from DHCS or the authors. Citation of the source is appreciated. Do not reproduce or distribute this presentation for a fee without specific written authorization from the MTAC project. And we are here today for the Mobile Crisis Services benefit, the new Medi-Cal Mobile Crisis Services benefit. And this is directly from the BEN, so I'm sure you've all read it or heard it a million times at this point, but Mobile Crisis Services are to provide rapid response, individual assessment, and community-based stabilization to Medi-Cal members who are experiencing a behavioral health crisis. The focus is really on that brief intervention, de-escalation, stabilization to really reduce any immediate risk of danger, and just really avoiding unnecessary intensive or restrictive interventions. The new direction, that is the new direction for Mobile Crisis Services, is that it's more resolution focused in the community and providing relief to people. So through that brief intervention, and through that, we are using the least restrictive means necessary. So unnecessary use of law enforcement, emergency rooms, or inpatient hospitalization. Mobile crisis services should be person-centered, trauma-informed, equity-driven, again, brief intervention, working from the lens of the least restrictive interventions, culturally responsive, linguistically appropriate, and accessible. Today's presenters are myself, Danielle Ragib. I'm a licensed clinical social worker here in the state of California. I've also previously worked for a mobile crisis team for a county, and I am a training and technical assistance specialist with the Center for Applied Research Solutions and the MTAC TA Center. So that's me. I'm going to hand it over to Monica Reeves to give a quick introduction of herself. Many of you may already know her as well. Monica?
Good morning, everybody. Monica Reeves. Many of you may have met me through the Crisis Care Mobile Units program. I'm recognizing a lot of familiar names in the chat, and definitely a lot of familiar counties that we work with through the Crisis Care Mobile Units program. I work as the project director for the Crisis Care Mobile Units with Advocates for Human Potential. We serve as an administrative entity on behalf of the California Department of Healthcare Services to provide that funding pass-through and technical assistance support to counties and other entities that are either implementing or enhancing existing mobile crisis services in their counties.
Thank you. Here's our agenda today. So we are going to go through some of the BEN 23025 requirements on transportation. We're going to talk a little bit about determining appropriate transportation needs. So there are times when you're out in the field with someone and it may be safe to transport them voluntarily or not, and how to partner and collaborate for transportation needs. So that includes non-medical emergency transportation. And then we're going to really share practical strategies from the field, because that's really how we learn, right? Is learning what other folks are doing and how they're doing it. And and that's why we have Monica here today, because she leads the CCMU project, and one of the key components on that project in terms of building infrastructure for mobile crisis units is around transportation. So we're going to really look at what's being done in the field, what counties are doing, and we're going to look at all different kinds of things, some challenges that they've identified, what's working for them, how they've used some of the CCMU funds to actually purchase vehicles or really establish a healthy transportation program or a component of their mobile crisis team. And so we're going to get into that a little bit today. All right, today the main learning objectives is understanding the BEN and what it says around the transportation requirements for when a Medi-Cal member needs additional care beyond the actual mobile crisis service encounter. And then learning practical strategies utilized by some California counties regarding transporting members and leveraging infrastructure funds related to mobile crisis services. So one level of leveraging infrastructure funds that we're going to speak specifically today to is the CCMU project. All right, we just have a couple questions. We want to just get a little bit of information from you all just to kind of have a better idea of what's going on out there. Um, if I don't know, Stephen, are we actually running a poll? Oh, we are. And here you go. That's the first question. Does your county currently transport individuals in crisis directly in county vehicles? Wow, much bigger, much higher percentage than I realized. I'm just going to give it a minute. We've got 69% of you answering. Just give another second or so. See if we can get some more answers. All right, 60% of you are transporting in county vehicles directly. That's high. It's much higher than I expected. That's awesome to know. 8% of you are not too sure. So would love to hear more about that when we get to the discussion point. All right, moving on to the next question. Does your county have formal partnerships or collaborate with law enforcement or emergency medical services, EMS, for transportation of individuals in crisis when needing further treatment? And formal partnership would be like a MOU, something along the nature of an MOU. Wow, quite a bit of you. That's awesome. We have 65% of you answered so far, and with 82% saying yes. It's great. All right, let's move on to question 3. When using non-medical transport, does your mobile crisis team accompany the individuals in crisis when a warm handoff is necessary? Pretty good percentage of you do. That's awesome. It's a really great way to provide care. We're at 68% of you responding, with 56% of you saying yes. All right. Well, thank you very much for participating. We appreciate that. It was really great to see the responses and just to gain a little bit more knowledge. All right. Now we will review the BEN and what it specifically says around transportation. Facilitation of a warm handoff. So in the BEN, the BEN states in some cases a member may need to be transported to a higher level of care. And it gives examples such as a sobering center, a crisis respite center, a crisis stabilization unit, so a CSU, or a psychiatric health facility, psychiatric inpatient hospital, general acute care hospital, or crisis residential program. If the member does require that higher level of care or that further treatment, the mobile crisis team is expected to connect the member with that appropriate level of care option that has been decided upon. And it may be something that you decided together or that there was a determination that had to be made by facilitating what's called a warm handoff. And it sounds like at least half of you were already doing that, which is great. And so the mobile crisis team shall also arrange for or provide transportation to really have an effective warm handoff if needed, to make sure that there's this like smooth transition of care for the person in crisis, and that there's just a little bit of continuity of care during that process. And so there is additional guidance on transportation as part of the mobile crisis encounter described in in section V, lowercase d, of the BEN, and there are additional components to reimbursement there as well for transportation. Next slide, please. When needed, a mobile crisis team shall arrange for or provide transportation to appropriate level of care treatment. So when it's determined that a person in crisis needs that higher level of care, the mobile crisis team is to arrange for transportation. You may transport the member directly, which a lot of you are doing in county vehicles, as part of providing the mobile crisis service. If that's not an option, meaning maybe you don't have county vehicles, your team doesn't transport directly, there are or there's like some sort of safety concern, and we'll go into that a little bit as well, that doesn't make it safe to do so, the mobile crisis team can also coordinate with non-medical transportation, also known as NMT providers, EMS, so emergency medical services, or law enforcement if necessary, to arrange transportation and ensure the member gets connected to the appropriate level of care in a safe way. If EMS, NMT, or law enforcement are utilized to transport the member directly to a higher level of care, the mobile crisis team is expected to remain on site until that transportation provider arrives. And so that means if it's a determination has been made that this person needs a higher level of care, it's not like, okay, we made this call, we put in a call, we made this determination, now we put in a call to EMS and they're coming, so see you later. It's no, we're going to remain on site and make sure this person gets safely to where they're going and the provider is able to safely get them into the vehicle and all of that. At its discretion, the mobile crisis team may have one or more team members actually accompany the member inside the vehicle to a higher level of care. If the mobile crisis team provides transportation or accompanies a member who is being transported by either an NMT, an EMS, or law enforcement, as of July 1st, 2023, there is an opportunity to receive an add-on reimbursement for that service. So that would reflect the expanded nature of that actual mobile crisis encounter. So if you're providing the actual transportation directly, or if you're actually accompanying the person in crisis, there's that add-on reimbursement opportunity as well. Determining appropriate transportation needs. And that can be tricky, right? You may make a determination at some point that someone is safe to be transported directly in a vehicle, and then it could go sideways, right? I'm sure you've all been in a situation where that happens. And I'm actually going to hand it over to Monica now.
Great, thank you so much. So there, looking at transportation as a whole, it's really important that you're able to respond based on what the presenting behavior or risk is of the individual that you're working with. And so when it's determined that you have an emergency transportation or emergency situation, or where you need that assistance for either immediate medical attention or high acuity behaviors that make it unsafe for a mobile crisis team to provide transportation, it's really important to have a lot of different options in your bag of options for providing transportation. So obviously you're going to kind of triage that need when you're out in the field and trying to make this determination. For the emergency transports, you are going to be looking toward law enforcement, EMS, those type of resources that have a little bit more support and are able to provide services that you as a mobile crisis team member aren't necessarily equipped to provide. When it's determined that you need a warm handoff, this is where you can also get fairly creative on how that is going to be. I've seen agencies walk individuals to resources. I've seen people drive in a county vehicle or in an agency vehicle for the most appropriate level of care. So it's really trying to determine first what that need is. And now we're just going to look at practical strategies from the field that we've learned as we've worked to implement mobile crisis teams in the counties. There are a few questions that you really need to look at as you're designing your transportation strategies for your program. You really want to look at what are other counties or neighboring agencies doing in your community. What are they using? It's really important to not have to recreate the wheel, right? And we also want to learn what works and what doesn't work. And so if you're new to the transportation game and providing for these services in your community, you really want to look at what's going on in your area that's working for either other counties or other communities within your county. You want to know what those receiving programs are used to. So you really want to be working with your hospitals, with your jails, with your stabilization programs, with your outpatient providers. You want to look at what type of transportation services have they been working with in the past to see if that's something that you can piggyback on, or if there's something that you're realizing there's a gap within those services as well, that you can work with those agencies to come to some type of solution with for what works best for not only the individual that you're working with, but all of the parties involved that are providing services. You want to look and see if your county or your agency has existing memorandums of understanding or formal agreements with any transportation companies. Not only with the transportation companies, but you may have agreements with some of those receiving programs, those facilities or receiving outpatient programs. So you're really going to want to do your research and make sure that you're aware of what partnerships already exist before you go designing your transportation strategies. You may notice that in different parts of your county, there might be different types of transportation due to logistics, due to population, due to mountain ranges in the middle of your county. So you're really going to want to kind of do that all over analysis of the lay of the land, what's going on at that particular time, so that you all can make the best choices on what is best for your agency. And you want to make sure that whatever strategy you come up with, that it applies, that you're able to provide services to every single person in your service area. And make sure also that the transportation agencies that you may be working with are able to also provide the type of transportation that you're needing based on that analysis of what you find as your needs. You also want to look at other programs in your county that can be leveraged to provide or partner on transportation. So you may partner with another mobile crisis program, or you may want to partner with your city, with your other county staff. You really just want to look at what other options are out there for you to be able to either build upon or partner with those agencies on providing the best transportation for the clients that you serve. So another strategy for partnering with transportation providers is, as I mentioned before, is establishing those MOUs or contracting directly with those transportation companies. What these do is it gets the proper individuals to the table to discuss and identify what the need is. And then it comes up with a partnership and a collaborative plan on how to meet those needs. Having an MOU or a more formal agreement really puts it down on paper and solidifies that understanding between you and those other agencies, so that when an emergency situation comes up, when the need for transportation arises, that everybody knows what to do, everybody knows who to contact, everybody knows the process by which they need to abide by in order to make sure that the individual gets the services that they need. I cannot stress enough the importance of these MOUs or formal relationships, and making sure that these are revisited consistently throughout the duration of the relationship, because staff change, dynamics change, political impacts, service delivery, it changes. And so you're really going to want to make sure that you have consistent opportunity for you to keep connecting with these providers to make sure that should there need to be any tweaks or any issue or any changes to the agreement, that you can work on that. Here we see if the mobile crisis team provides transportation or accompanies the individual on the transportation to wherever they're going. We do have that add-on reimbursement. So really that, could incentivize your teams in making sure that you are staying with that individual. You are providing the support not only to the individual, but to the transportation company as you take that individual to where they need to go. Here we go. All right, so here are some strategies for non-medical emergency transportation. So we talked in the beginning about, identifying, is this something where the individual is voluntary, where an agency can safely transport an individual, or is this an acute situation where it's not safe for the mobile crisis team to transport, or the individual maybe has some other extenuating circumstances that make a more secure transport necessary. We're going to talk about the non-medical emergencies. So some of the counties that we've worked with have developed MOUs with their local law enforcement and EMS to transport anybody when they need whether they need to go to the emergency room, whether they need to go to the stabilization center, whether they need to go to a housing provider or the outpatient clinic. Some have actually developed actual contracts. So this is an actual contract where the county or the mobile crisis provider actually pays the transportation company or reimburses the transportation company, or the transportation company takes that referral and is able to bill Medi-Cal for the transport. So that's another really great way to solidify those relationships, is getting into that a formal, not just an MOU, but getting into a formal contract with a transportation agency or with law enforcement. It is important to talk about these particular questions when we're developing the contracts, however. So again, we're a little repetitive right now, but it's really getting as much information as you can before you develop into that agreement. Look at what existing transportation companies will do, with special focus on timelines, accessibility. It's great to have a contract or an MOU with a transportation company, but if it takes them 3 hours to arrive for a transport, that's a problem, right? We need to ensure that the capability of these transportation companies is able for them to respond immediately or fairly quickly when a transportation situation is needed. Also to make sure that they are staffed up enough to be able to provide those services. I've worked in mobile crisis for quite some time, and what I found that worked is we had a plethora of options for transportation companies. We didn't just rely on one transportation company to provide solely all of the transportation. Of course, maybe in some more rural and frontier areas, there may not be the resource that is available to have many agencies to choose from, but it is important to be able to have more than just relying on one if they're not able to respond immediately every single time. You also have to look at what the allowability is of those agencies. If they're a non-medical transport, but they're transporting in an ambulance or an EMS type vehicle, you need to make sure that within that transportation company's policy that they're able to have non-staff people being transported along with the individual that you're serving. So all of these things are really good discussion points and points to also highlight in an MOU or a formal contract. All right, so here we go. Now if we're continuing on with non-medical emergency transportation. So I want to give you some examples, and it's going to be really exciting. We're going to be able to show you some videos. We're going to show you some pictures of some of the vehicles that other counties are using. But we want to provide you specifically Riverside County. Some of you may have seen their news. They had a news bit on a local news station that showed their vehicle. Sonoma County, they have purchased a new modified van that we're going to show you. The Hoopa Valley Kamau Medical Center, they're in the process of purchasing a mobile crisis vehicle that you're going to be able to see kind of the layout of that. So we're going to cover that. These are all vehicles that can be used to provide that non-medical transport. But also within there are built-in safety features, so that should someone need a little bit more secure area in order to transport, that staff that are transporting can remain safe. And then the types of vehicles that can be purchased. We're going to look at converted vans, converted ambulances, SUVs, sedans, RVs. There's really, the importance is looking at what your community needs and what is best going to meet that need. But you can get very creative. I've seen some mobile crisis agencies that they just use sedans and they go out into the field. And a lot of times those are agencies that partner with transportation companies and law enforcement agencies, but they can provide transport if the person is voluntary and it's needed. All right. So crisis care mobile units. So those of you that have met me, I'm sure, or have heard me speak, have had heard me talk at length about crisis care mobile units. So just to, in case you are unfamiliar with what this is crisis care mobile units is a funding opportunity that's been provided by the California Department of Healthcare Services. And what it does is it provides funding for counties or tribal entities to implement or enhance mobile crisis services in their communities. Some of the communities we work with already had existing mobile crisis teams. So this infrastructure funding that we've provided helps to enhance those teams, purchase vehicles, software and hardware, outfitting the mobile crisis teams, providing leadership, infusing peer support services. There's really a long list of what infrastructure has gone into creating or enhancing these teams. Some of the teams did not have a mobile crisis team at all. So we did offer, when these funds became available, we offered some limited funding to help the counties and grantees get off the ground and employ direct service providers into those mobile crisis teams. So in a nutshell, the state provided $150 million of state general funds and $55 million in federal funding that has gone to building and continuing these programs. As of right now, we have awarded more than $185 million across 48 behavioral health authorities and 24 different tribal entities to either create or enhance these mobile crisis services. Out of this, I remember when we first took when we first did quarterly reporting and counties were reporting on the number of teams, I believe we had 160 back in 2022. Our most recent count, we have over 390 mobile crisis teams throughout California delivering services now. So it's been quite a wonderful project to see our state expand services for those that need it. Again, those of you familiar with crisis care mobile units, you guys will really recognize this flow chart that we developed. So this is basically everything in the purple triangle is what our crisis care mobile unit funding covers. I said in the previous slide that 48 of the 58 counties are contracted with Advocates for Human Potential to implement these mobile crisis teams. So for those counties and tribal entities, the things in this purple triangle are what are allowable under that funding stream. We're allowed anything that relates to the actual deployment of the mobile crisis team. So the van is the kind of the centerpiece of what this funding is about. But just to back up, we'll kind of walk you through. Obviously, we create these programs because we want to work with the individuals in our community that are undergoing some type of behavioral health crisis. We want to connect them with the most appropriate services at the right time, at the right place, involving the right individuals to serve them. So when a person is in crisis, they are able to access help through a multitude of ways. Some are able to call 988, some call 911. Some mobile crisis teams or crisis services and communities have a direct link to their mobile crisis teams, a direct number, so that the person or a concerned individual about an individual in crisis will call to access mobile crisis. What is allowable under our funding is everything that happens from dispatch on. So we provided funding to mobile crisis dispatch units that are able to triage those calls and deploy a mobile crisis team. Same thing with 911 to CCMU, outreach and marketing of the services, training law enforcement, training other social service providers, training schools, any of those partners in your community that you really want to get to understand what mobile crisis teams are and how they are available. That is all part of this process as well. So once we move from the person in crisis, the referral to appropriate agency, we have the deployment of a mobile crisis team. And this is where the vehicles come into place. This is where the resources that a staff needs to conduct mobile crisis assessment comes in. So laptops, training tools or assessment tools, uniforms, safety gear, kind of, you name it, whatever's needed in that moment, we can provide under this funding mechanism. And then what we also cover is this last part of the triangle is those warm handoffs, follow-up, referral to other community-based services. We also have been able to provide field-based telehealth. So I know in the bin, it does talk about if you don't have a clinician or somebody that's able to do an actual assessment on the team that's deploying to the field, I could see this being very useful in more rural frontier areas, is that those individuals can be able to connect via telehealth to a licensed clinician, to a waivered clinician that could be able to provide the assessment intervention piece to the mobile crisis interaction. So this is also something that is allowed per the bin. And we really encourage agencies to kind of look into this, not only not because we want you to rely solely on telehealth, but we want to provide the options to ensure that everybody that's in behavioral health crisis is able to receive some type of intervention in the best way possible. And then after the intervention takes place, an individual may safety plan and the individual stays in the community. They may go to a crisis stabilization program, another outpatient provider. They may be at other receiving centers. They may go to the hospital. They may go to jail. They may, there are other, our goal is to definitely keep them in the least restrictive environment as possible. But part of the things that are unallowable for the Crisis Care Mobile Units Award is those actual other services. So those more restrictive services, the crisis stabilization, the outpatient programs, the facility-based services, those are not covered. Everything that we cover under Crisis Care Mobile Units really exists in the community where the individuals are. Ultimately, our outcome, we want to improve the health and safety of everybody in our community. We want to improve the health and safety of the individuals that are experiencing behavioral crisis. We want to support their natural supports. We want to support our community members to make everything or to make everybody safe and having those improved health outcomes. We really want to decrease hospitalization and jail for individuals where this setting is not appropriate. And I think for years nationally, we have over-relied on those restrictive environments because we didn't have the infrastructure in place to provide these services in the community in the least restrictive environment as possible. So, and we are seeing this, we are making impacts, even though we still have individuals that go to the emergency rooms, are hospitalized, are detained. We have individuals that go to jail. Though it's important to have those resources still exist in the community, but as long as we can do our best to try and keep people that are seriously impacted by their behavioral health issues out of those environments when it is not appropriate for them to be there. We don't want to send them there just because that's a place that they can be held and taken away. And so the one thing great about the Crisis Care Mobile Unit funds is it leverages, this funding is able to leverage other funding sources within your community. So you have to be contracted with Advocates for Human Potential under the Crisis Care Mobile Units Act or Crisis Care Mobile Units contracts in order to receive any of these funding opportunities that I was just speaking of. That doesn't necessarily mean that you don't have funding available to also provide these services in your community. Many counties choose to use mental health block grants or other funding mechanisms to provide these services, which is great. But the Crisis Care Mobile Units specifically gave funding just for this purpose. There may be future funding opportunities for other vehicles and equipment to purchase transportation vehicles for each county. It's really important that you have somebody within your agency that's looking for those funding opportunities. Somebody that's checking the federal and state grants databases and consistently looking for those opportunities to enhance your services through the funding sources. CCMU may have sometime next year additional funding for vehicles and other equipment. That will be something that we would communicate, of course, after we hear from DHCS. But that could be something that if you are an existing county with a CCMU contract, there may be opportunity for that coming up next year. And then we're gonna jump right into like, look what types of vehicles that the grantees have purchased using the crisis care mobile units using the crisis care mobile unit funding that they were awarded. All right, and now we're going to jump into what first we're going to show. Let's start with the Sonoma County transportation vehicle. So this is a van that the Sonoma County, one of their mobile crisis teams within their community, had retrofitted to meet the needs of that particular team. And this is a video from the manufacturer of the van that is showing how they laid it out, showing kind of some of the tricks and enhancements that were made to the van. So let's jump into that and watch this video. That's our partners with the SAFE team in Sonoma County. One thing I wanted to point out on that video is, if you notice, there was the barricade between the driver's section and the rest of the vehicle. And that was very intentional because we want to maintain the safety of the operator of the vehicle while they may be in transport or conducting services within the back of the vehicle. Another thing I wanted you to notice was they had workspaces there. So they had they had chairs that swiveled and turned around to a workspace where a staff person or an individual that is being served can have a place to write, can have a place to work on the computer, can have a workstation, maybe when they're not providing some type of direct service to the individual. Another thing I wanted to point out is you notice there was one chair on one side, and then there was capacity for three people on the other side. And this is really intentional as well to ensure that you're meeting the need of that person. If that person prefers not to be right next to someone, there's a lot of people, I mean, I could go into scenarios all day long about trauma or different things that might trigger an individual's behavior. They may feel safer sitting by themselves, face to face with a clinician or an interventionist on the other side. There's also opportunity for, if somebody needs to have a little bit more closer proximity, you could have two staff with an individual sitting in the middle, making sure that you have a safe transport going, from point A to point B. So you have to look at what the needs are of your community, what the needs are of the individuals you're serving, so that you can make sure that you're designing a vehicle that best meets those needs. So let's go ahead and jump into the Riverside video now.
Riverside County has new tools to help respond to behavioral health crises.
The goal is to reduce unnecessary psychiatric hospitalizations and law enforcement involvement. Eyewitness News reporter Mark Cota-Robles shows you how this grant-funded fleet of specially equipped vans will work.
There's a new approach to crisis response in Riverside County, and it's on wheels. 5 specially equipped vans are part of a new team set to be dispatched to assist in emergency behavioral health care. And we got a tour inside. There's space for nurses, therapists, and peer support.
We can do a full screen and assessment, while they're parked on the side of the road or wherever we're called out to. We can turn our generator on, keep it cool in there so we're not out in the 110-degree heat like we are right now, or in the rain.
The new crisis response team vans can respond to homes, schools, even homeless encampments. The fact that the teams are mobile will help increase accessibility to this critical healthcare resource while reducing unnecessary psychiatric hospitalizations. It also means less law enforcement involvement.
Law enforcement doesn't want to arrest anyone when it's not necessary, and we don't want them arrested either.
There's a motorized wheelchair lift, so any individuals who have ADA needs can get in the vehicle easily. And we can also bring other partnering county agencies, folks like our county housing authority, so that we can work together and help connect people as rapidly as possible to housing and other resources.
It's part of a $1.8 million state-funded grant. The vans now gassed up and ready to roll, reaching any corner of the county in under 30 minutes. Mark Cota-Robles, ABC 7 Eyewitness News.
So another thing I want to point out in this particular video is, you know, not all communities need something of this capacity to address the services that are required in your community. One thing that you can do with these mobile crisis vehicles, if you choose to, you set them up as a mobile office, and they can mobilize to an area of the community. You know, they may want to set up shop one day in a parking lot somewhere that is a centrally located area, where you can have you can deploy directly from there, but you can also serve people that just want to walk up and access services directly to you. They had an awning built on that so that, you know, that extends the square footage of the vehicle. So maybe on those days where it's not 110 degrees, or if it's not cold and blustery and raining, you can use that outside area as an area to provide services as well. You're going to hear me say this so many times. It's really dependent on whatever the needs are and the demographic of the individuals that you're serving. And so you want to design something or provide transportation that really meets that need. But I just get excited looking at these videos. Here's another really great example of a mobile crisis vehicle. And I'm trying to give kind of a range. You know, we started with the conversion van. We have kind of the Class C motorhome looking thing. This is now almost like a recreational vehicle that they've converted into a mobile crisis response unit. And so you're going to see here, this is the actual customized layout that the Hoopa Valley Tribe Kamau Medical Center has developed for their community. And so you'll see here, they also have an ADA lift. They've got wider doors for individuals to get in and out. They've got medical triage areas. They've got bathrooms. They've got areas where you can have a behavioral health counseling intervention. They've got they've got partitions to ensure that you can separate the areas if you need to. So if you're serving more than one person at a time, there is capacity to do that. They also have built-in, safety features. They've got cameras. They've got the generator, much like the Riverside unit had, air conditioning, things like that. So it's really, and this is really a heavy-duty vehicle too, because in that area in which Kamau Medical Center is a very, mountainous, various terrain. So they wanted to design a vehicle that they could really get to go over the logistical areas of their community and make sure that they can provide services to all areas. So these are just a few examples of the types of vehicles. Again, you can have SUVs, agencies can have sedans, you can have other types of conversion vans. We've had Sprinter vans, we've had other types of vehicles that have been modified to meet whatever the need is. I think probably the biggest piece, or not the biggest piece, but one of the enhancements that's really necessary in these vehicles is making sure that you have accessibility in them for the individuals you serve, for you as staff, accessibility, ability to get to the areas you need to go. Also having the technology that is important for these vehicles. So having a GPS, having Wi-Fi capability, things like that, so that the individual that's serving the person is able to connect outside of the car, is able to perhaps do some work on the data entry or writing a report, whatever they need to do to be able to make sure that they're able to provide the services that are necessary. There are challenges we wanted to highlight quickly that could come up as developing transportation. So one of the things is that not all counties have the protocols needed to provide the transportation that's necessary. We did see in there that we have most counties provide some type of transportation. There are some that don't. I worked in a mobile crisis field where we did not provide transportation. We relied solely on EMS and law enforcement to provide transportation to us. So you really need to look at if providing transportation is something that you want to do as directed by the BIN. You really need to look at what your county protocols are. You need to make sure that you have the policies and procedures in place with your own local leadership to make sure that it's able to be done. I saw a question just come up about the cost of these vehicles. There is such a large range. Some of these can be as high as $700,000 for one vehicle, as low as 50 or even less, I guess. I want to say that the average cost for maybe one of those conversion vans, you're looking in the $150,000 range for that vehicle completely outfitted. But there are so many resources that we have here in California now because we have so many counties that have gone through the purchasing process, that have identified vendors, that if you're interested in purchasing one of these vehicles, we should be able to have a lot of information for you on where the best place to go to customize something that works for you within your budget. The other challenge is that stock, COVID really put a dampening on our ability to receive these vehicles. So whether it was the chips in the cars or just the actual vehicles themselves, we've had some agencies have to drive out of state to go get a vehicle, or some that have taken over a year to receive. So that's been a challenge. Another thing that you have to look at is transporting individuals under the age of 18. You again need to look at your local policies and procedures and find out what you are able to do as part of your mobile crisis. And then you have to look at the differences between a voluntary transportation and an involuntary transportation, because those are very real dynamics that exist in the communities that you'll need to consider as you're developing your system. So in summary, we just want to say it's very important that you all become very familiar with the BIN 23-025 about the transportation requirements that are within that BIN. There are key considerations for determining the types of transportation that are needing in crisis. So look at what the needs of your community are. Look at what your already existing relationships are with other agencies and transportation providers in your community. Utilize your partners, utilize us, utilize your partner counties. There's a ton of expertise and resource out there for you to look, and maybe even some of your neighboring counties. Just so that you guys can start discussing how to best have consistency and sharing and leveraging those resources in those multi-county areas. And Danielle, did you have anything you wanted to add before we jump to questions? And I know I took all of the time except for 5 minutes.
No, that was great. Thank you so much for sharing everything that you shared today. I think that's really helpful to just see the types of vehicles, how they're setting them up, how much they're potentially spending on them. It can be costly, but here are some opportunities for additional funds. And so thank you so much for presenting that and really bringing your expertise from the other side of the infrastructure project as well. We do have some time left. Any questions from participants, any wonderings? Please feel free to place your question in the chat. You can also raise your hand through the hand emoji or try to unmute yourself and ask a question. We have a few extra minutes. Oh, there's one question, Monica. Where did the idea of the vans come from?
Where did the idea of the vans come from? So again, it's all part of looking at what the needs are in your community. Another piece is that there are a lot of states that have been utilizing mobile crisis teams for many years. So there's been already an evolution of how transportation strategies have been worked out. And so there's examples through other states about what other agencies use and don't use. Ultimately, it really is what is the best use of your funding, what will meet the need of the individuals you're serving in your community. So whether that means, and looking at the transportation capabilities within your within your county. If you're unable to transport individuals, and that's going to be a very static decision within your county or within your mobile crisis system, you don't necessarily need a fully outfitted van that has the ability to bring people inside or transport individuals. You may need a vehicle that has maybe an office space where you as a staff person can conduct work, but you wouldn't have to build in all of those client factors or individuals we're serving factors into those vehicles. So it really depends on what the need is. We have some counties that are very large or maybe even rural, and so they may have one or two mobile crisis offices within the county, but you're seeing that there's an uptick in requests in other areas. It might be good to have a vehicle that you can take, much like the Riverside van or the Sonoma van or even the Hoopa Valley RV, take that vehicle and mobilize it in one of those communities where there's not a mobile response office. Two things happen. One is you're much more closer to the situation if you get called for a mobile crisis response. Two, it's built-in marketing. You're setting up shop in a local grocery store, at a mall or a park or wherever that you're going to go. That's marketing for the services that you're providing, but also providing opportunity for interested individuals or individuals in need to come up to your unit and ask for connection. You can conduct those warm handoffs. You can refer to local resources. You can address whatever the needs of those individuals are. So it just depends on whatever the need is in your community and what you guys are going to utilize the most, depending on the need of the crisis situations in your community.
Lamika is asking if we would be able to make a regular workspace for mobile crisis staff. Are you talking about in terms of in the van? That would really, I think that's what you're asking, and that would really be determined on what your need is. So if your need is to have your teams regionally located throughout your county so that response times are quicker, you can do that. If the purpose is not to actually transport individuals in crisis, but just keeping your team housed regionally, and they have access to computer or internet or just even having electricity to be able to charge up cell phones, tablets, things like that, then yeah, you can use a van as a workspace, and some counties are doing that. Some teams are doing that, as Monica stated. But thank you all. I realize we're a minute past time, so thank you all for being here, and thank you again, Monica, so much for being here and bringing your expertise. And I hope you all have a great day.